Afternoon, everybody. You're at the Ubuntu radio in the time of Corona. So since last week, our conversations on Corona, where we are discussing the different aspects of the Corona crisis. So last week, we discussed the future of the global world order. And this week, we are discussing liberal state and global governance in post-COVID era. Today, I will be discussing this issue with two of my colleagues, Professor Nicos Trimikliniotis and Senior Lecturer Emel Akçalı. Welcome both, Emel and Nicos. It's a really pleasure to have you with me today. Now, Nicos is joining us from Southern Nicosia, Emel from England, Loughborough, and I'm in Northern Nicosia. So, first of all, before we discuss the issue, ask you, how are you coping with the coronavirus crisis? How is it going? What's going on in England and what's going on in the South? Emel, do you want to start? Yeah.
I mean, it's a lockdown here, but it's not as, strict as in some other European countries, like in Italy or France. Mm-hmm. You don't need a permission to go out. You can still go to parks, and I don't think you can leave the cities, but you don't need to have an authorized permission in order to go out. It's just been suggested. So this is not just a very strict rule as it is in Italy and in France. I don't know the situation exactly in some other European countries. But although obviously, as long as you are not sick, you are doing okay.
Mm-hmm. Okay.
So, yeah.
Nicos?
Well, we have a very strict lockdown system in the Republic, which is very much a lockdown of pretty much everything except for vital operations, governmental operations, food chain, emergency services, and that sort of thing. This has been generally observed. But there have been serious problems. I'm one of the privileged ones in the sense that I do have a roof over my head. I have a job. In fact, we're very busy as a professor, and we're much more busy now than we were before. But there are those who do not have these privileges, this possibility of having a roof of their own over their head, homeless people, or people in detention, or people in refugees, in so-called reception centers, which have been closed down and have become closed centers, and the conditions there are not the same as they are for the people outside. Supposedly the rules apply to all, but they don't apply in prisons, they don't apply in detention centers, they're not applying in for those who cannot afford them. Also bear in mind that there are groups of people who are outside this support network, and they are not those who are working, for instance, in the informal economy, and they can't even have basic income, although there are measures to support, and solidarity has been used under pressure from the labor movement for 60% of your income if you have to go off work, another support for basic income. Those who fall outside this net of protective net happen to be outside. But overall, we're okay in the sense that the numbers of the contractions of the disease have been they're in check. They're being reduced. I think 5 or 6 were yesterday. The number of deaths in Cyprus overall, it seems to be pretty low, north and south. In the north, what I know. Unlike Cypriots in the UK, who I read now, and I'm following the news very closely, there are over 250 deaths in a community of 200,000 altogether, Cypriots, Greek Cypriots and Turkish Cypriots together, which is a very large percentage in comparison to the general population.
Okay, before we start our discussion, I want to introduce you guys, for those of you who doesn't know your background. First of all, I'll start with Nicos. Nicos is a professor. He's a legal and sociology expert. He's a professor of sociology at the School of Social Sciences, University of Nicosia. He heads the team of experts of Cyprus team for the Fundamental Rights Agency of the European Union. He has researched on citizenship, asylum, immigration law, fundamental rights, free movement of workers, reconciliation, conflict and reconciliation, state theory, work, and precarity. Emel Akçalı is a senior lecturer in international relations at the Swansea University in the United Kingdom. Previously, she was an assistant professor at the International Relations Department of Central European University in Budapest. Her research interests are state, society, conflict, and politics in the Middle East and North Africa, social movement, neoliberal governmentality outside of the Western realm, critical realist philosophy, and non-Western and alternative geopolitical discourses. Okay, guys, so I want to start with my first question. And my first question is, does COVID-19 undermine the liberal democratic state? There's been a long-term, since the COVID-19 crisis has started, this discussion going on about this, whether there's going to be like long-term kind of consequences when it comes to the liberal democratic state. So what is your take on this? Who wants to start first?
Do you want to? Okay. First of all, I want to mention that I think what I have recognized the right-wing populism, which was kind of still considered at the margins of the, let's say, the liberal state politics, liberalism, the liberal. If we were talking about the European liberal state, or in the periphery, the liberal states in the EU periphery. I think that this right-wing populism has become more mainstream during these coronavirus times, because the type of actually the steps that the states have taken have followed mostly these more lockdown, the Chinese, the authoritarian type of lockdown, and then the border closures, and going more kind of curtailing also immigration. And even it was a surprise, for example, the United States took a one-sided decision to stop all flights coming from Europe and the European countries, which are considered to be its the closest allies. All these actually demonstrate that this more kind of, again, maybe authoritarian approach, or security, or kind of a more militaristic and a hard security approach to deal with this pandemic has become more mainstream. So this is, we all can also see that in the militaristic narrative. I mean, in the how the coronavirus or this pandemic has been securitized, and also with more militaristic discourses. For example, how we also see how Macron, the French president, kind of formulated it as an unseen, unknown virus, as if this virus is the enemy. And then the French need to stay at home, protect the state, and protect also the public health service. So you kind of, and you can see the same type of similar discourses elsewhere as well. In UK, the people were also called to save and to be a kind of a human shield against the national health system. And you can see similar type of discourses as well. I mean, recently Trump has also identified the coronavirus as the unseen enemy, and then the United States too. So these are more militaristic type of narratives in order to, they're formulated in order to fight with the virus. So you see a kind of more hardcore, hard security approach that the states, the liberal states even, start to take when to deal with these pandemics. Obviously, a lot of people can say, but is there another way? Have you ever thought about another way in order to deal with the pandemics? Obviously, security, there is not only one way to look at security. There is the hard security, a hard approach to security, a more traditional way of looking at security. There is also something called the human security approach. It's a non-traditional, non-conventional way, which puts more emphasis on the human approach and also the health security. If, for example, these countries, which we also see that in the security reports, the pandemics were actually expected. I mean, if you look at the security reports of all European countries, including Turkey, that the states were expecting a pandemic ever since SARS. Okay, and you can also see that ever since SARS, now the countries which are really successfully dealing with the process are the ones who have already had this experience before. But the ones who didn't have any experience of this, maybe there is a bit of a narcissism that this pandemic would not touch I mean, they would stay in Asia, or it would be a problem in Africa, like Ebola. They would never touch the kind of the European liberal center. So that's why they haven't actually invested in this health security or human-based security approach. If they did, then they would have increased the capacity to deal with the health capacity, the intensive care units, or they would invest more in the doctors, protecting. But we have seen in the last years exactly the vice versa. In France last year, the doctors were protesting. Here, the salaries, I mean, the NHS also has lost a lot of public spending investment, and in the United Kingdom has not been investing, has been going into huge cuts in the national health system. We all already know the situation in the United States, which doesn't even have a system called like a public health system. And we have seen some similar examples, especially in northern Italy, for example, which is the region that is touched the most, which is actually one of the richest regions in the world, not only in Europe, northern Italy, Lombardia, but also in the world. But right now we see that it has been touched the most severely. People would expect this more in southern Italy, where you don't have so many facilities. But because of that, because of how the health system was regulated until now. So it shows that the countries still tilt towards a more traditional security approach whenever it comes to any kind of global issue. This can be a refugee issue. We have seen how the most liberal states actually deal with the refugee issue. They fire on them. We have seen the climate change, and we have seen environmental degradation. And now we see also in the pandemic that the states, actually the liberal state, prefers to deal with it in a very hard, traditional way. Is it the only way? No, it's not. So that's something that we can actually be optimistic about. If we change the mentality, we can actually approach these type of processes differently as well. So that's how I see, the liberal state, the future, this is what I see, and I will conclude here, can go to both directions. It can go to even more, continue with this traditional approach, even making it more stricter. So if we can see more a closure of the states, or it can actually go to the other direction as well, where the liberal state doesn't need to actually curtail the basic rights and freedoms, but they can change their approach to how to, their mentality in how to approach this problem. Thanks.
Thank you, Emel. Nicos?
Yes, I think there are tendencies that push towards more authoritarianism in the liberal state. But I think what we are seeing primarily is a major contradiction in the very heart of what it means to be liberal today. In the sense that the logic of the last 40 years, which is the imposition of the neoliberal order, has created the conditions which made basic health provisions and health rights being impossible to be offered in the face of a problem like a pandemic like this one. Whereas we knew that this was coming, we had the ample warnings that there would be a possible pandemic. In fact, the US itself under Obama was preparing, had a plan of this kind. Who was warning? We knew that this was a possibility. We knew that the previous diseases which were connected to this, like MERS, like SARS, was coming to this, yet they failed to do so. So the contradiction in the states, in the liberal state and liberalism today, is on the one hand, they are failing in their basic, inverted commas, function. Their basic function, which is provide protection, provide security for people. Now, the emphasis, I think the contradiction here is much deeper, and is shown in the way in which they failed to react properly in the beginning. Remember, there have been in the initial responses to the pandemic were twofold. There were those who insisted that this is like which pushed for this idea of the herd immunization. Leave it to the people. Leave it to the kind of a laissez-faire approach. The logic of we can't do much about it. It's about we'll have to leave it to the natural forces, which remind us of a previous logic, which is it takes us back to Malthusianism. It takes us back to logics about people who are leaving it natural disasters to kill off people and they kind of impose some social Darwinism. Only the survival of the fittest will survive. So the survival of the fittest would be the logic. So this was one approach, but quickly countries which initially had this approach, such as the UK, switched. The only countries that remained in this logic were to Sweden, which continues to a country in the size of Greece, has 10 times as many deaths as Greece, which went for the approach to impose measures, hard measures. So I think this shows the contradictions that exist within the state. Now, at the same time, whether they take one approach or the other, what we are seeing is the creation of new regimes of exception, new states of exception and derogation of rights. This is a trend because part of the approach is this duality that exists in the state. On the one hand, social control through welfare, invoking solidarity and basic provisions for all or for those in need. And on the other hand, penalization of anyone who contravenes the kind of measures, anyone who considered to be deviant, to be outside, anyone who considered to be dangerous. Now, in our work with Arisitas and others, we have one of the 4 classifications of deviance, which was called miasmic deviance. Anyone who is deemed to be carrier of a certain virus or certain types of behavior which can be transmitted to others. We are seeing this type of deviance being mostly criminalized, and I think this is where the big danger lies. So I think that these contradictions within what it means to be liberal is at the heart of the contradiction today of capitalism. And for the first time, we're hearing some people are calling for nationalization of the basic services of health systems. We heard this from the EU commissioner at one point. But of course, after the end of, as we're now moving towards this redefining, the countries that are coming out of this crisis or think they're coming out of the crisis, because there is always a possibility of a second wave. What these people are trying to do, they're saying the following. They're saying, okay, what do we do about the situation? We need to recoup profits. We need to impose new measures. Whilst at the same time, we need to protect the population. So I think there is here there are new domains of struggle emerging, and it's a question of which ones of this logic will prevail. And this is why it's very important, and I agree with Emel, that there are alternatives here. It's not that we have no alternatives. It's just that in crisis situations, those in power invoke the state of exception, the state of emergency, to impose measures, and they are telling everyone, let's rally around everyone. It's a warlike situation, and let's deal with it. But now we are gradually, at least many countries, not the UK, not the US, but we in Cyprus, some other countries are also thinking, Austria, Germany, they are talking about redefining their own normalcy. And what does normal mean is now being defined by the crisis itself, which has done what? It has created new types of inequalities and has amplified much more the inequality of the world, which are threatening to become explosive in the world afterwards.
Okay, so this brings me to my second related question. I mean, I think you partially kind of answered this question, but I still wanted to kind of ask, I mean, do you think we should be concerned about these authoritarian actions on the part of the government? I mean, can it become even worse?
Can I come in on this perhaps because I think what we saw, and I agree with them, that this is the new populism and new penalizations has been going on even before this crisis.
Yes, exactly.
Look what's going on with the treatment of migration. Migration became the big issue, and asylum became the big issue. Just take the example of Cyprus. For the first time, we had a policy, a very negative policy. The first thing that the right-wing government did was to close the checkpoints, to stop the moving of people from the two sides. even before we had a single incident or north and south, without taking any measures. The second thing they did was to have a pushback policy. They imposed, for the first time, we had a situation where we denied the right to non-refoulement, which is a fundamental right for anyone who's in asylum, was denied. This is not confined to Cyprus. Malta is doing the same thing. Italy has been doing the same thing. The closures of borders. Orban has created the conditions to have this. But now it has provided the perfect opportunity. It's like a perfect storm, an opportunity to bring all these new right-wing politics and to legitimize them and to make them more mainstream in the context that we've been talking about. And I think this is a major threat to democracy as we have known it. And this is the domain of the big struggles for what we will do next. Partly they want to externalize the problem, they want to keep people out, but this is not just about that. It's also about what types of measures which have been imposed temporarily and how many of these measures are likely to stay. Also, the kind of new surveillance that exists. Now, we're talking about data, personal data. We're talking about people who are moving, checking who is moving, checking who is doing what, and also connecting them with health data and the justification for it. Look what will happen with traveling. I mean, some people who are abroad, I mean, I've been reading about what will happen with new airlines. Emirates imposes a test before you can get on the airplane, so you can know what viruses you have. Soon, all of the data will be merged together. So we will have more authoritarianism in that sense, and more algorithms deciding whether we can travel, whether we can move, whether we can have access to X, Y, and Z. Now, this is a redefinition of democracy as we have known it. And I think the domains of struggle are growing. And I think that the other major thing that we need to address is that in this during the pandemic, we had one more issue, which is the big differentiation, for the different types of workers. Those who are considered to be supported and protected, and those at the front line who are likely to be exposed and in more danger. In this situation, we had the redefinition of what does it mean to be a frontline worker. So even the poorest sections of the population who are working in agriculture, sometimes irregular migrants, have become essential workers, together with the doctors, together with the nurses, the delivery people, again, poor migrants doing these jobs. So we're talking about major social transformations together with the political transformation, and this is a question of how will this be regulated. And I think this is a matter or a domain for struggle in the immediate aftermath of this crisis.
Emel, do you have anything to add?
Yeah, I think the problem is that we should have been concerned by now by many of the things, and some of these issues Nicos already talked about. But as I said, there was this type of response, the authoritarian response, the rising authoritarianism, right-wing populism already in the last 10 years or more. I mean, I don't count. But in many countries in the world, especially also coming through within the European Union borders as well. So now what I'm saying is that what I have said, and I will reiterate, that this right-wing populism can have the tendency to become the mainstream during the crisis. This can be, okay, of course, pandemic crisis, migration crisis, or some other crisis. But I was listening to, I don't know if you know, this French philosopher, Bruno Latour. It was a French friend who sent me the link because I'm interested in his work. So he actually says that we should see this crisis as an opportunity. I mean, this is a one-time in life opportunity. We can see things clearly now. All the right-wing, I mean, the consequences of the neoliberal politics, the consequences of the right-wing populism, where they can lead us to the fault lines, especially when you see right now in many states, in especially the southern states in the United States, I mean, people protesting, but for the wrong reasons, protesting against the lockdown, I mean, for the wrong reasons. And you see the posters saying, sacrifice the weak sacrifice the old people, we want to be out, and such things, for example, these type of very dangerous narratives, discourses, these are the fault lines and all the liberal societies. We are seeing them all very clearly. So we see actually the picture very clearly now. We see how, I mean, people, of course, the United Kingdom still tries to call people to unite around a very nationalistic discourse around the NHS, protect the NHS, like, BBC called them to call people to clap the NHS every Thursday. And, this kind of NHS is part of the British identity, is a part of British pride. So they're trying to appeal to this British pride in order to conceal the fact that the NHS lacks resources to fight with this pandemic. The United Kingdom is not protecting its citizens. So they're trying to, and also the pro-government media is underreporting the deaths. United Kingdom now is, I think, the European country which is experiencing the highest number of deaths. Yet the emphasis is not on that. I mean, at the beginning, the media were even considered, if you look at actually the pro-government, the first page of the pro-government media, you would never see these deaths, right? You will see some other news, or you will see protect our wonderful NHS and things like that. So it's also very hard because it's part of the British national pride. It's also very hard to criticize the national health system, which is not actually, I mean, a lot of doctors here are dying, losing their lives because they lack the necessary resource equipment. And this is a shame, actually, for a country like Britain, who is exporting, who is producing and exporting technology. I mean, for a country like this, for United States, which is not able to even provide gloves, masks to its own, to the doctors, is actually a big shame. So we are seeing these things clearly. This is an opportunity, okay? And, this is an opportunity. And we also see how some other countries who have invested in the health system, South Africa, for example, apparently because of the Ebola experience, they have prepared much better in order to fight with this pandemic. We see this also in countries like Singapore, the Asian countries, Southern Korea, Taiwan. So there are some good examples. And so while we are able to see things so clearly, it is also an opportunity for us not to repeat the same mistakes. So as I said, should we be concerned? There are two paths. Two roads diverge in a yellow wood. And it depends on which one you take, actually. It's also consequences, of which road you take, the path you take, is going to create the future for us. Shall we be concerned in that sense? I'm not so sure. 50-50, I would say.
Okay, guys. Another issue that came out as a result of this crisis was the lack of cooperation on the part of the state. So I don't know. I mean, can this really highlight the need for global governance? And global governance is not only needed to tackle the coronavirus crisis. Obviously, we have been dealing with another issue, climate change and global warming for quite some time. But what does this crisis tell us about global governance?
Shall I go ahead, Nicos, or I don't know? So there was especially a problem with global governance before, especially in dealing with all these problems who are considered global commons. For example, the environment is a global commons. This is not a problem. And also, maybe in the past, I have written also about this. I said that, in Cyprus, for example, in the Cyprus conflict, the environment, to deal with the environmental problems, degradation, can be a way to bring the communities together because it is something that all communities share in Cyprus, for example. So this was also part of the United Nations policy. If you take care, because these are the global commons, these are effect, you cannot prevent these things, the consequences of environmental degradation by military, by borders, by frontiers or whatever. So there are other things. For example, the space, space is a global common. The oceans, the other things that we use. And this is also the pandemics is something that we need to deal. It doesn't recognize any borders. It doesn't recognize, well, in the case of COVID-19, of course, there are more vulnerable people. But at the same time, we also see that it can touch anybody from any class, from any age easily as well. So in this sense, this is something that it needs a kind of a more common understanding and common reaction, common responses to that. But we have also lacked this. I mean, in the global governance side, the world has never been doing okay. Okay, so also in the previous pandemic, in the SARS, the countries have not responded well. I mean, because you need to share information. The WHO asks the countries to share all type of information, but there are problems with that because some countries fear, Indonesia, for example, in the SARS crisis, feared to share the information because they were scared that this information is going to be used by the big pharma, by the big, actually, companies. They're going to create the vaccinations and all that by using actually the data coming from Indonesia, and they're going to sell it, with the prices that Indonesia cannot pay or cannot afford. So there's also this kind of there's this third actor. There are the states, but there's the big pharma, these big companies, which hold actually the right of the medicine, the right medication and the vaccination. So this is another problem. This is why countries try to nationalize this right now. They try to all fund their own national responses instead of sharing them together. Second thing, I mean, this global governance in the WHO, I think one more problem with that is the kind of the finances. Right now, we have also seen that, the United States, for example, is threatening the WHO by not financing it, with not financing it and all that. So there's also this issue. I mean, we see type of this problem inequality of the global governance also in this situation, as we have seen in some other situations. To be very honest, I'm not very hopeful about this because thus far there have so many shortcomings. Though in 2005, I think the WHO created an understanding, a report, an understanding that actually the countries should respond should be more cooperative. And maybe now, after this pandemic, this will be strengthened. And but about this, maybe we can discuss later. I would like to hear also what Nicos is thinking, but I'm really not very hopeful about the fact that global governance actually will be stronger from now on.
Okay, thank you. Nicos, I think we had lost Nicos for a bit, but did you manage to
yes, I was disconnected because of instability. Yes, I got the point. Yes, I think that what we are seeing today is a collapse of neoliberal global governance. What we have seen now is an abysmal failure of neoliberalism as an ideology, which has been the orthodoxy of the way in which global governance has been organized. So in this sense, the immediate response of this, which was a kind of the laissez-faire approach of leaving things, we are seeing this being undermined by the very actions of states trying to do something and reacting in a very different way. So we're seeing this, and at the basis of this, of neoliberal global governance is what? Free trade, free movement of people, capital, products, and in this sense, and data and information. Now, in this sense, how have the states reacted in this way? They have immediately erected borders. So the first victim of this was the EU. The EU collapsed essentially. In the crisis situation, the EU was not there at all. It's ridiculous and it's a shame, and it's really we're not proud as a Cypriot to have a Cypriot person in charge of health saying we're ready and seeing the immediate collapse of this situation. So we're seeing the collapse of Schengen and free movement, which could have been done in a very different way. If it was just a policing matter, they could have done it a policing way, not as an immigration matter. Immediately they pulled the borders to control what they have. Now, others, and they show this as a natural thing in the sense that how do you contain a disease? You close up spaces. This could be done, this should have been done if there was a proper global governance to respond to this in a much more coordinated way. Not each state acting on its own as it liked, when it liked, if it liked. So we have a collapse of this at the heart of this. And I think that what at the same time, so this is the idea that we need a nationalist response. At the same time, it shows that the nationalist response, the response of each nation state for its own to be safe, it's completely ridiculous. It cannot happen, because each country there's so much interdependence now that we're stuck. Now we are in an small island country, which we are unable to get basic resources if they are not responding in a way that allows us. Now, what has the US done? The supposed leading force of this globalization. It's confiscating masks, it's confiscating gloves, it's confiscating all sorts of things which are designed for elsewhere. So it's violating free trade, which is the kind of which is at the core of their ideology. Now we need at the same. So what I'm trying to say here is that the system of global governance as a neoliberal project cannot work. It's the end of it. Of course, it's likely they would want to forget this after the crisis continues, after the crisis is hopefully over for them. But I think it is not. We know that as a paradigm of government, it's not working. But we also know that to deal with the crisis, you need global cooperation in a way that you haven't thought about. You need a global system of health in the way that we have never imagined. And we are, who are people on the left and have been advocating, could have never put things in the terms that we should be putting them now. Because to deal with a pandemic, you need a global system of health. To deal with a pandemic, you need a global system of investment, not big pharma determining what we should be doing and priorities we should have, because it is their failure. It was more profitable for them to invest in finding how did Chomsky put it, for face lotions, rather than to create conditions to deal with a crisis like this. It was more profitable for pharmaceutical companies to create things that were more profitable, not what is good for us as a humanity. So I think these issues are at the heart of matters now, if we want to have a chance of answering things. And I think what Emel said about the diversion policy of most government and the media, which has failed to deal with the issues, is an effort to divert attention from what is really at the heart of the matter. We need now to think about the nationalization of health systems, massive investments in health, and preparing for the next crisis, which is not going to be away from now. And it's not going to be as exogenous as it is presented, whether it is a health hazard or whether it's other global hazard like the environment or whatever. It has been put on the agenda. And I think this requires also the nationalization of the banking system to put investment in a rational way, not what is possible, what is profitable. At the same time, we need basic universal income now for everyone. It shows we have 2 billion people working in the informal sector in a 7 billion population of the world. Now, these people are completely unprotected and are themselves potential carriers who need to be protected. So what I'm trying to say here is that things that seemed unthinkable and sort of utopian 3 months ago are no longer utopia. They are what needed to be done. Now the question is, which are going to be the forces that will push for this to happen? And I think that's a dilemma which is not just for us as theorists, as analysts, as academics to think about. It's also a matter of new social struggles in front of us.
I agree. Okay, another question is, in what ways does this pandemic highlight and kind of exacerbate, deepen the inequalities? Because constantly there's a narrative that, all of us is experiencing coronavirus in the same way, but actually we see that it's not really the case. I mean, there are differences between different classes, different races, different refugees. And I read an article yesterday, and according to this article, the number of people who are suffering from hunger is expected to go to be doubled soon, because in third world countries, people are already struggling with hunger. And if I'm not mistaken, it's expected to reach something like 250 million. Now, the question is, what would your answer be to this? What's happening to inequalities as a result of the COVID-19 crisis?
There is a fantastic Facebook group I spend a lot of on Facebook also for my academic purposes. I even wrote a book about it. But there's a fantastic Facebook group which is called The View from My Balcony or The View from My Window. And if you just go there, you can see actually clearly these global inequalities about who are kind of the winners, who are on the winning side and the losing side of this global pandemic. What happened is that the very privileged, obviously the pandemic also touched them, but maybe they could have access to better services, the private healthcare systems or whatever. They could get tested right away. So they received better care and they got well. But during this time, they could actually retreat to their fantastic residences. And then so it was very easy for them to say, stay at home, don't go out, or to look down on people who need to go out, or to even call the police. This has actually created all these, the police in the individuals, the police state in all the individuals. They call the police, they shame the people who need to be out and all that. And then the middle class, and I put myself a little bit in this, as Nicos said, we are kind of also the lucky ones because we have a roof on our head, we have a salary. We don't have maybe a villa in Florence or somewhere in the Caribbean, but we have nice houses where we can stay. But the middle class is working at home as well. I'm a mother of a 9-year-old, but we also need to work, and I need to also homeschool her. So all of a sudden, we have become the middle class, has become the teachers, also doing the work, keeping up the salary, but also homeschooling the children. In UK, for example, there is no online education. So we need to deal with this all on our own, which I find it actually good. Then I can control what my daughter is learning or not. And then the front line, but the class that is really actually on the front line in our fight against this pandemic is the working class. The working class in the streets, still the public transport station is full of them. The working class is doing all the work, for us, and they don't want to, because they're scared also to lose their job. And in the working class, you have a lot of minorities, obviously. Okay, so that is why, for example, the minorities, the refugees are also helping a lot in many of these countries, and they're volunteering because it is also a chance for them to be included in the society, to be seen a little bit, because we are unfortunately treat the refugees as if they don't even exist. They have their life. They're not part of the society. They're not even, they have their life. They don't push them. So right now we see all these vulnerable groups on the front line, while the rest of us is either protecting the state, the healthcare systems, or just, seeing this as a nice kind of a holiday in the places that we have retreated. And then, all these people are using posting their nice pictures, or I have gone out, I have walked, and this is what I did, whatever. So this shows actually all the inequalities. Just a little bit browsing in the social media will show you where the inequalities, the fault lines are very clearly. And this can be actually a fantastic paper, just staying, doing your field work. It's called virtual ethnography, actually, just doing your field work on the social media to see these inequalities. That is also why, for example, in Britain, the first doctors, the healthcare providers who unfortunately lost their lives were, for example, Muslim doctors. The first 3 doctors who died were the Muslim doctors, the minority doctors. Still the minority in the United States, it is the Black American community, apparently, which has been hard. All the communities who don't have access to these services, and also who are still the bus drivers, for example, the transportation workers. So yeah, this is, again, as I said, if we go back to Bruno Latour, this is a nice opportunity for those of us who want to see, because now we are seeing this even more clearly. But again, what type of action we are going to take later, that's something we are going to see all together.
I agree. Okay.
Can I come into this?
Yeah, go ahead.
As we know, I agree that we have the pandemic has proven to be a powerful revealing mechanism of the sort of inequalities that were there and were actually for many years hidden by the public realm, within the public realm. And I think this is something we have to really realize. I referred to some figures. Last year, the figures of the ILO, I'm referring to the figures of the ILO, for instance, last year, which shows the sort of inequalities that were actually there. But these inequalities, and I agree that all the evidence and all the research has shown that it has been massively expanded and enlarged. And I think that what we're facing now, immediately in the aftermath, will be a massive humanitarian crisis. Massive humanitarian crisis, as we have never seen in non-war situations. Now, the last pandemic we had of this kind, of this quantity, although we had the recent ones, was in 1918 with the Spanish flu. This is the most, and no one has such an experience, a memory experience of their own. They have died by now. We have to go to wars to compare the two. But imagine what we are talking about here. When India decided to issue a lockout, and there were all these hundreds of thousands of migrant workers within India who were asked, aren't you afraid of the pandemic? The answer was, I don't know what I will have for dinner tonight. When they said, what about, aren't you going to respect the lockdown and go at home? I have no roof to put it over my head. So we realized this right from the beginning. And I think that what we have seen is a major enlargement of this inequality in this context. So whilst the rich are able to retreat, some retreat in our homes and wait and have the delivery migrant or the other poor delivery person bringing us our food on the doorstep with our masks. Others even go further. I mean, the mega rich, what do? They go to New Zealand. I've been reading about these mega rich people who go to New Zealand in their bunkers for nuclear, in the event of nuclear disaster. So we are talking about these sort of major expansion of inequalities. That's why, I think that inequality is going to be the biggest disaster we will face in the immediate aftermath of the pandemic. And unless this is addressed, it's going to be explosive. The system, as Immanuel Wallerstein said, is going to orbit out of it's going to go out of orbit. And let's not forget that we know that pandemics have been crucial in transforming the world in the past. In Capital, Marx talks about the plague, which has changed the whole way in which workers were organized. And after the plague, in the immediate aftermath of the plague, and how they organized the system, was that the governments, like the governments in the UK back in the 1860s and 50s and these sort of times, more than 150 years ago, were looking to ration food and ration basic material so that people avoid what they called at the time starvation diseases. What we don't know about the pandemic is that once it spreads in much poorer countries, in Africa and in other Asian countries, once it becomes a massive pandemic, as in Latin America, as it will spread there. It's spreading already in Brazil, for instance. What effect it will have is that people will die out of other diseases. They will die out of poverty and out of the fact that they won't be able to be offered the basic services. And we know this experiment because it's taking place now. It's a massive sociological experiment being used in the United States with the people who are uninsured and unprotected, and they're dying, and we have mass graves in New York. The richest country in the world has mass graves in this context. So we are talking about a major issue which is revealing itself in front of us now.
Okay. My fifth question is, how will the health security and global governance be shaped in the post-COVID-19 world? Nicos or Emel, do you want to start?
Yeah, so we don't have a lot of time, right? So we need to kind of summarize it. Do you want us to summarize?
Yeah. Because there's another question that I want to discuss.
Okay, so I actually have partially answered this question. The health security issue, there are two paths that we can actually take. the countries invest more, I mean, see this pandemic as a health security, but do not securitize it, do not approach it from the perspective, from the angle of hard or traditional security, and they invest, actually. This is what, for example, the Germany has been doing, or some other countries has been doing. I mean, there's a kind of a very basic message of the WHO. It says more testing, more testing. And if with more testing, for example, that we can, with more testing, with increasing the intensive care units of the hospitals, or funding actually the health system, the sector in the countries, we can come up with some other ideas. I mean, the quarantine, the lockdown, the strict lockdown, the border closures, complete kind of turning back to, you know, the nation state, to our own selves, maybe don't need to be the only option later. This is, for example, what South Korea has done. So if we are able to do more testing and only quarantine the people who are carriers or who are sick or whatever, you know, I mean, there can be some other ways of dealing with this issue, perhaps. So it doesn't have to, again, curtail the basic rights and freedoms in the future. So it all depends on how you are approaching and where you are investing. You are doing your investments. So I'm not sure, to be very honest, I don't know which path the countries are going to take right now. With the current governments, it doesn't seem like they're going to go towards the non-traditional ways at the moment. But who knows, maybe one casualty of this pandemic will be that all these populist governments, right-wing populist governments, will go away. Who knows? So, you know, I'm not that pessimistic, actually. It can also be that that we won't see, and then they will also be held accountable, responsible for what they have done. So it can also be a different world. I mean, maybe we are going to suffer a little bit, but after this, one of these casualties actually is going to be that this mentality is going to decay.
Okay. Nicos?
Yes, I think that this is a major call for a radical shift of public health globally and at national level. People now, I mean, they're talking about securitization, how the fear, we're talking about the emergence of new ecologies of fear. And the new fears now, and this is where academics, scientists, intellectuals who are concerned about the future of the world have to illustrate now to people that, do you want more useless bombs and bullets, or do you want more beds in the hospitals? I mean, put in these sort of terms. Do you want more ventilators to breathe, or do you want bullets? That's the sort of stark choices people will be faced with. And it is very clear what people should want. Now, I'm not frightened of someone who's going to come and kill me by a gun. I'm frightened because I have no protection, and the state is actually failing. So in this context, we need to think about the possibilities of something else. Talking about more, I could agree with more testing. Trump last night was talking, we shouldn't be afraid. Even if we had tests with 350 million tests, they would say we should do 2 tests to kind of divert attention from the fact that actually he hasn't been testing. Whereas the success of South Korea, or if we take a small country like Iceland has tested 20-30% of its population. It's a small country, can do more. So this also think about scale. But if we take a mass country, a big country like China or South Korea, another big country in comparison to our countries, we can see that there are different ways of organizing ourselves if there is a determination to actually deal with this issue. Now, of course, it's how we deal with it. When we're talking about testing for whom? How? Who pays for it? So this is why I said that we need a nationalization process and heavy investment and a switching of resources away from the wastages of defense, military spending, to health, to education. I'm talking about investment in education and investment in research. I mean, this is something we really have to think about. And in order to do this, we need global cooperation. because it's not a question about this country or that country succeeding in this, but global cooperation to deal with this. At the same time, in each country, we need basic resources and a basic industry to deal with emerging situations. So the kind of the big thing that has been there since the days of Adam Smith that talked about comparative advantage. In emergency situations, there is the comparative advantage is the country is able to survive. So you need basic services, strategic industrial services, which are good for the environment and good for local countries to be able to switch and to be agile. So in this sense, if those countries who are able to switch, producing, for instance, something, vacuum cleaners are producing ventilators. Those countries that have industries and services that can produce other things are able to respond to crisis. So we have to think in these terms and put this on a global plan and then think of it locally what should be done. So I think this is a rethink of public hygiene, of public regime, public health. I think it was Michel Foucault who spoke about the hygiene regimes. This calls for a new hygiene regime globally and locally.
Okay, this brings me to my last question. We are broadcasting from a de facto state from the TRNC. So I wanted to ask you a question about de facto states. Like, where are they situated in the global system during this pandemic? And of course, if you could say a few things about Cyprus, that would be really welcome.
When I thought about this subject, the first country that came to my mind was not Northern Cyprus, but was Taiwan, actually, because Taiwan has been really doing well in fighting against this pandemic. And it's a successful case study, but we cannot learn so much from it. And the WHO is not responding to Taiwan or is not treating it as an equal partner. There was maybe a video somewhere that when the person asks about Taiwan, the UN officer doesn't even want to mention it, because even mentioning the name of Taiwan is going to put the organization in trouble with China and such things, for example. So this I thought that this was an interesting example. When we're talking about global governance, of course, there are these regions, there are these countries in the world which are called de facto, which are not in the official system. They are not even considered as the real places that the real people are living, and the real people are dealing with real problems. And Taiwan is an interesting case in that, for example. And then we are maybe following the example of China, but we are not following the example of Taiwan in that sense. So this kind of creates the problem between the de facto and de facto, de jure, the world. So the same with this, the case of Cyprus. Maybe I will leave it to you, to the Cypriots, although I am one as well. But I will leave. But you are actually living there. So maybe you can close it better, because it's your own experience. Mine will be a bit too patronizing, perhaps.
No, I don't think so. But I thought it was interesting because we've been always kind of complaining about the isolation of the North. But it seems like that thing, which was like something that we've been complaining about, became an advantage in this case, because we kind of used isolationism from a very earlier stages to kind of minimize the impact of COVID. But of course, I am a little pessimistic about what this is going to mean for the future of the island, because this means like nowadays the prospect of a reconciliation and a federal solution is no more being discussed. So that kind of worries me a little bit. But in terms of an immediate reaction to the COVID crisis, in terms of tackling the problem, I think this isolationism was interestingly an advantage for us. I don't know, Nicos, what do you think?
Well, I think that of course, each region has to be isolated. We are in isolation in our homes now. So isolation, in this sense, is used in a different in different ways and can mean different things for this situation. It was tragic, and we have reported on this in our side, if you look at the analysis that we have made on human rights, the first casualty of the crisis here was the closure of the checkpoints by the government, by the right-wing government of the Republic of Cyprus in the south, by the Greek Cypriot side, to invoking this, which without having an incident. At the same time, remember that I was lucky enough. We had a discussion on this subject since February. We had two lectures at my university on the sociology of coronavirus in Cyprus, and we had a radio program discussing it. And that time, the two leaders came together and said, we have to have coordinated action. And I thought, great. I mean, if they can respond to this sort of crisis in a positive way, it shows that we can be optimistic. At the same time, bear in mind that this forces us to collaborate. How? Look, we know that we're an island. You know, the two sides have to collaborate if we are going to deal with a problem like this. And this mix pulls us, although we have a kind of a de facto border between us, which is not recognized, it also forces us to think of what it is that we should be doing to deal with a crisis like this one, but also different crises. Don't forget that this is one type of crisis. But if the danger would come from outside, and it is coming now, if we manage to contain the situation, both north and south, we've been very successful in containing. The danger would come from outside, from airports, from other kind of things. Then we have to collaborate on dealing with this. Secondly, if we're dealing with environmental crisis, we have to collaborate. So I think that this negative situation for now can be turned to our advantage, because it pushes us to think, hang on a moment, we are two sides of the same coin. And unless we find ways of collaborating, thinking of how we can utilize the situation that we're small countries and we're a small country, and to divide it in two parts, and we need to think of ways to think like an island in the global system, perhaps there is much more an advantage in this context. So there's no discussion about a federation, but I think if the two units that are now there in practice, de facto, wrongly, with a tragic way, can find ways of uniting, they can find ways to unite with one crisis response unit. So each one in its own kind of context, in its own local level. So what I'm trying to say here is that there is also a logic that emerges for the potential for reconciliation, reunification, and federal building from below. And I think this is something we have to think about in the context of thinking about the return to this normalcy as it's now defined.
Well, thank you very much to you, Nicos and Emel. We have come to the end of our program. And I will be here again next week with another guest of mine at 3 o'clock. So see you next week. Bye-bye.
Bye. Thank you.
Thank you.